In this video, we will go over the dispensing of solid oral medications, also known as tablets, pills, capsules, as well as the dispensing of liquid medications to your residents or participants. Going back to kind of hygiene, and never touch the tablet or capsules with your fingers. If you have any kind of hazardous medication, such as finasteride, methotrexate, misoprostol, that you're handling that medication appropriately. And if it's a medication that pregnant women should not handle, that you're ensuring you get a non-pregnant member of the facility to help you pass that medication. Be very aware of the do not crush list. There are many medications that should not be crushed. So this can be in reference back to the pharmacy resource handbook that we have. And if you have any questions as to whether or not a medication should be crushed, give us a call. Let us know, and our pharmacist can talk you through that. If the doctor has written a medication for a patient that is a crush only patient, and that medication is on the do not crush list, we can look for alternate routes, alternate forms that comes in. And if that's not available, then we can talk with the doctor and see the best way to move forward. So please don't ever hesitate to contact us or the physician. So moving right along with tablets and capsules, if your resident is not able to swallow a prescribed tablet or capsule, please contact our pharmacy and we can see what other options there are to be able to administer that to the resident. You can crush a tablet using 3 souffle cups, placing 2 cups stacked together, the medication, and then 1 cup on top, and crushing it that way. And make sure that when you are mixing that crushed medication with applesauce or pudding, that you're placing that food in the cup first and then the medication on top. When a resident has a medication that is only given under certain parameters, make sure that those parameters are being met before you combine all the medications and crush them together. That can just lead to unnecessary waste of the medication if the patient didn't actually need that blood pressure medication, or just a medication that the doctor would like to see X before giving the medication. Residents should not swallow anything that is marked as sublingual or buccal. If it's sublingual, it should be placed and held under the tongue, as well as buccal should be placed in the cheek pocket in the resident's mouth to allow for it to dissolve. Make sure that all powder is removed from the cup after you've crushed it, or the plastic pouch from the Silent Night tablet crusher. And then when you're administering crushed medications and liquids, just be aware that they may not always taste the best. So just be a little more sensitive to the fact that the resident may not want to take it, and you may have a higher refusal rate. So be aware of how to handle that. And if you run into any issues, don't hesitate to contact us, the physician, your clinical staff at the facility there. There are different types of liquids. There are suspensions, there are solutions. Suspensions are medications that are, as it suggests, suspended in an oral solution. Solutions are medications that have dissolved into the solution and become a part of it. If the dose cannot be precisely measured with just a simple cup, ensure that you're using an oral syringe, or if you have another type of device that's able to accurately measure those. With all of our liquids, we provide a oral syringe to be able to help you in that accurate dosing. If you're pouring medication out of the bottle into a cup, ensure that you're pouring it away from the label. So you're pouring it down from the back side of the bottle. That just helps in the event any kind of dribbling, dropping of the liquid doesn't interfere or mess with the label. If you pour too much liquid into that cup, don't ever pour it back into the bottle. You'll just have to waste it and pour out that extra into your designated access location. Ensure that you are rinsing the medication cup with a little bit of water or juice and then having the patient take the rest of that liquid from the cup. And this is just to ensure that that resident is receiving the entirety of that medication dose and none is stuck to the side of that cup.